Okay, so we have liver disease and failure from things other than hepatitis. So the pathophysiology deals with the functional liver tissue gradually being destroyed and replaced by fibrous scar tissue, which this eventually leads to the connective tissues forming constrictive bands that disrupt the blood flow and the bile flow within the liver, and then the blood can no longer flow freely, which restricts and causes portal hypertension. So, the causes of this disease outside of hepatitis include alcohol abuse, which the overconsumption of alcohol eventually leads to cirrhosis of the liver. And that is because an overconsumption of alcohol keeps the liver in a constant inflammatory state and it can't repair itself in time. And then you also have NASH, which is the non-alcoholic steatohepatitis, which can be closely related with diabetes and fatty liver disease. And then you have medications such as Tylenol that the liver will not be able to process when you take it in too high of a dosage over a constant period of time. And then you have hemochromatosis, and this is when the body absorbs an excessive amount of iron from the diet, which is then deposited into various organs, mostly the liver. And the iron is stored in the liver and it can cause damage that may progress hepatitis into liver cirrhosis. And then you have Wilson's disease, which is copper accumulating in the body, mostly in the liver and the brain, which can cause cirrhosis as well as fibrosis. So some complications can include hepatic encephalopathy, portal systematic encephalopathy, esophageal varices, and acute graft rejection post-liver transplantation. So some early signs and symptoms could be dull aching pain in the upper right abdominal quadrant. There will be rebounding tenderness upon assessment. They could also experience weight loss, weakness, anorexia, diarrhea or constipation, as well as portal hypertension, and this is of course caused as the liver disease progresses into liver failure. That goes back to talking about that blood flow constriction. So some diagnostic procedures that can be used to diagnose liver failure and liver disease not caused by hepatitis is an ultrasound, which is used to detect ascites, hepatomegaly, biliary stones, or biliary obstruction. We would also do an abdominal x-ray and CT scan, which is used to visualize possible hepatomegaly and ascites. An MRI would be used to visualize mass lesions and determine whether the liver has malignant or benign masses. And then, of course, liver biopsy is the most definitive. A liver biopsy identifies the progression and extent of the cirrhosis. Okay, so some labs and testing that will be done will be your LDH, your ALT, AST, which these are going to be elevated due to hepatic inflammation. We'll also do the blood bilirubin, which would be elevated due to cirrhosis and the inability of the liver to excrete the bilirubin. We'll also do blood protein, which should be decreased due to the lack of hepatic synthesis. The expected reference ranges for this would be 6.4 to 8.3. And then the blood albumin would also be decreased due to the lack of hepatic synthesis, and those expected ranges would be 3.5 to 5. Okay, and some blood tests would be RBCs, hemoglobin, hematocrit, and platelet count. And these are also going to be decreased. And then your ammonia levels are going to be increased because cirrhosis is going to prevent the conversion of ammonia to urea for excretion. And so medications and treatments. Diuretics are going to be used to decrease the excessive fluid in the body. Beta blocking agents, these are going to be used for clients who have varices to prevent bleeding. Lactulose is going to be used to promote excretion of the ammonia levels from the body through the stool. And then we could also use non-absorbable antibiotics. These can be used in place of the lactulose. Some therapeutic procedures are also going to be paracentesis, also to get the fluid off of the body, as well as liver transplant if they're a candidate for that. So the prognosis and nursing diagnosis, the incidence and mortality attributable to cirrhosis and chronic liver disease vary significantly amongst populations. This is because certain lifestyle changes can greatly affect the course of the liver disease, progressing into liver failure. So if its development is directly related to alcohol consumption, specifically the total amount of alcohol consumed, the number of years of excessive alcohol consumption, and blood alcohol levels. Women also develop cirrhosis at lower overall levels of alcohol use than men. And the biliary flow is also going to determine how fast the liver cells are destroyed. And some nursing diagnosis that we can see with this is imbalanced nutrition, excessive fluid volume, risk for impaired skin integrity, risk for injury, risk for acute confusion, disturbed body image, and deficient knowledge. These are due in part to the weight loss and anorexia, as well as confusion dealing with high ammonia levels in the body. And deficient knowledge could just be from the person not knowing that their behaviors contribute significantly to their liver disease, or not knowing how to change their habits, resources, or even being able to properly take their medications and take care of themselves. And these are the references.